The Covid-19 pandemic brought about several challenges, one of them being the rising cases in teenage pregnancies here in Africa. However, there has been a major challenge just finding out how many girls have been affected by all this. I am in Dandora, Kenya, where a particular effort has been made to change all this.
Faith Moniki is one such teenager. She was in high school when she met a man who impregnated her at the age of 18 years.
I got pregnant when I was in school as I was doing my final examination. That is when I found out. I felt very bad because you can imagine my classmates would finish their exams and join different colleges. But for me, I had begun an endless journey of motherhood. It was a bad feeling that made me want to abort, only that I could not afford it.
Distraught and depressed were the only things she felt, with stigma slowly creeping in.
The other major disappointment was that I got pregnant and I had to tell my mother. I had so much fear because I was so scared of her reaction. But I had to tell her. When she found out, she denied me food and did not come home with fruits as she usually does.
During the peak of the Covid-19 pandemic, a report from World Vision estimates that close to 1 million girls in sub-Saharan Africa will not be able to continue with their education because of teenage pregnancies. In Kenya, over 400,000 teenage pregnancies have been documented during this period. A majority of those affected do not attend the World Health Organization's requirement for antenatal visits. Faith went for her first when she was 5 months pregnant.
I knew that once you get pregnant, you only find out that you're pregnant, then you wait till the day of delivery. They helped me a lot, not only financially, but also in matters food and nutrition.
The data on the number of girls skipping antenatal visits is hard to find. However, the gap is already being filled by some organizations like MamCare, a program in Kenya, Tanzania, and Nigeria, among other African countries, that helps give pregnant teenage girls and women the financial ability to take care of their pregnancies when they need it.
And what we notice with teenagers is that they really face a lot of stigma within the community, which makes them then attend their antenatal clinics either really late or very inconsistently. And this, for us, from a clinical perspective, really poses a lot of clinical risk, because if we are not able to identify this risk early, then we're not able to mitigate this risk.
At MamCare, their pregnancies are tracked after they enroll into the program by receiving messages to remind them of their clinics and emergency contact numbers.
They're given access to a digital health wallet that is registered on MTIPA. This wallet is what allows them to have the ability to access their care and to have the agency to access this care. This wallet allows us to also be able to track their health journey over the course of their period in pregnancy, during their antenatal care, delivery, and their postnatal care. And using this data, we are then able to allow the health provider to have a digital overview of this data, really understand in their health facility how many women are of high risk, how many women are about to deliver, what are the challenges that they're experiencing.
Today, Faith has just received a reminder of her 8-month clinic date.
It's good because when you go there, they give you the full support. I was very scared in that I was hiding my pregnancy. I was wearing my brother's big sweaters just so that I hide it and would later get in trouble with him. When I got to the facility, they explained to me that getting pregnant isn't bad. All I needed was support.
The Samaritan Medical Facility in Dandora, Kenya is one of the facilities offering the MamCare support. They admit it hasn't been easy dealing with high numbers of teenage pregnancies, with most coming in with different expectations.
It's a little bit challenging. Some of them, they're here because maybe they were told we procure abortion, which is not. So when they come, they find we try to change their mindset so that they can keep the pregnancy, because it's hard for them.
For Caroline Amanda, who is 21 years old, her teenage pregnancy meant so many things in her life were going to change. Her daughter just turned a year old. She's had to make major sacrifices, including dropping out of school to make her life comfortable.
I did not know I was supposed to go to the clinic, And joining the Linda Mama program meant that I needed to submit my partner's document so that I can be registered. I don't have parents, and my partner has decided to abdicate his responsibilities.
The Linda Mama program in Kenya is one under the Universal Healthcare Projects that aims to offer insurance to pregnant women in the country, but it isn't perfect.
And it's been a really good first step at identifying pregnant women and allowing them to access care. But even within that first step, there are still major gaps. We know there are still not enough healthcare providers. We know we still have challenges with drug supply.
The financial aspect for pregnancy for these young girls, they think it's very huge. So that's why they try and run away from it. But through MamCare, it has leveraged their burden. So it picks them and holds them and gives them the support that is really much needed.
When I wake up every morning, I see my baby growing, and she only looks up to me. I'd like to go back to school, but I really can't for now.
Teenagers are vulnerable and more vulnerable during pregnancy, and experts advise of extra caution during this period.
In Kenya more specifically, our bigger goal is to really show that you can use data to drive care. And using this data, you can be able to identify the interventions that are working and scale this up for all pregnant women.
Experts also believe using data, a lot can be changed for a better tomorrow.